sorry your mother and your family experienced. And Ms. G, I want to address another horror that could occur to transplant patients, and that is what could happen to them if they lose their ACA coverage. In your testimony, you explained that transplant centers often will not even place a patient on the transplant wait list unless they have stable, continuous health insurance. I'm thinking in particular of one of my constituents from Sierra Madre, who is one of the longest surviving kidney transplant recipients in the entire country. He received his life-saving transplant decades ago and has been able to maintain his health because he's always purchased comprehensive coverage on the ACA marketplace, made affordable through the enhanced tax credits that Democrats enacted. But now, because Republicans refuse to extend those tax credits, his premiums for next year have more than doubled. He's terrified that he won't be able to keep his coverage and terrified of losing the transplant he fought so hard to preserve all these years. I also think of my friend and constituent who undergoes daily dialysis and is anxiously awaiting a kidney and is on the transplant list. But I think about what would happen to him and his wife if he is taken off the list because he loses his healthcare coverage. I know they would be absolutely crushed. So, Ms. G, can you speak to how widespread this problem could become if Republicans fail to extend the ACA tax credits before January 1st? How many transplant patients might be forced off the wait list or denied life-saving coverage simply because they can no longer afford the insurance that transplant centers require?
Thank you for that question, Congresswoman. First, let me say I'm sorry for the troubling situation that your constituents are in. Over 20 million people are currently receiving subsidies through the ACA marketplaces. On average, they will see their premiums more than double, increasing by 114%, according to KFF. In some states, premium payments will triple on average. According to the Congressional Budget Office, about 3.8 million fewer people will have insurance about 10 years from now if the expiring enhanced premium tax credits are not extended. As you mentioned, transplant centers commonly require that patients have insurance in order to receive a transplant. This is to ensure that donated organs go to people where they will have a highest chance of success, and so people who are uninsured are commonly turned away or not listed for transplants. In the case of kidney failure or end-stage renal disease, there is eligibility for Medicare for people whose kidneys don't work or are undergoing dialysis or have received a transplant, but millions of other Americans will have no choice for affordable comprehensive insurance without the premium tax credits.
Thank you. And Ms. G, Republicans claim that people like my constituents and their families should simply switch to cheaper junk insurance plans or rely on high deductible HSA-based coverage. For these constituents that are transplant patients, being forced into a junk plan or high deductible coverage would simply not be adequate. It could actually also be dangerous. A missed refill or delayed lab could trigger rejection of the kidney that they waited years to receive. And you multiply this by tens of thousands of transplant recipients, then we would have a healthcare crisis for so many Americans. Can you explain why these plans are completely inadequate for transplant patients, how being forced into bare-bones coverage could jeopardize their health?
Yes, so plans that are not comprehensive, including short-term limited duration coverage, association health plans, are not required to comply with ACA regulations. So this means that they can discriminate against people with pre-existing conditions, and that includes people with chronic diseases, with organ failure, or who have previously received a transplant. Non-compliant plans can do things like charge more or deny coverage altogether for people with pre-existing conditions. They may not cover essential benefits like hospitalization or prescription drugs, including the lifelong immunosuppressants that transplant recipients need, or rehabilitative services. They can also put lifetime or annual limits on coverage. And these plans also are not required to comply with the ACA's regulations on out-of-pocket maximums. In addition, high deductible health plans are, as the name says, plans with really high deductibles. They can reach up to $10,000 or above for family coverage. And that means that when someone needs a major surgery, including transplantation, or has a chronic disease or chronic condition, they may be faced with paying that full deductible out of pocket.
Thank you. I yield back.
Mr. Moran.